So something huge is happening in India in early 2026. They're about to launch one of their most ambitious public health missions ever, a massive plan to vaccinate millions of young girls against HPV, which is the virus that causes cervical cancer. Let's break down this incredible effort to fight a completely preventable disease.
All right, so here's what we're going to cover. First up, we have to talk about the staggering scale of India's silent cancer crisis. Then we'll get into the science of the virus and the vaccine itself. We'll break down the national game plan, explore the huge challenge of building trust, check out the digital tools powering the mission, and finally, look at what the single shot really means for the future.
That is a really powerful question, and it gets right to the heart of why this whole thing is such a big deal. The answer? It's a massive, resounding yes, and India is betting on it to save countless lives.
To really get why this is so urgent, you just have to look at one shocking statistic. 1 in 4. Just let that sink in for a second. India has less than 20% of the world's population, but it shoulders the burden of 1 out of every 4 deaths from cervical cancer on the entire planet. It's a completely disproportionate crisis. And that number? It's not just a statistic. It translates into a truly heartbreaking reality. We're talking about nearly 80,000 women in India losing their lives to this disease every single year. It's a silent epidemic that this vaccine is designed to stop dead in its tracks.
So you see, this is way more than just a health statistic, right? It's a crisis that often hits women in the prime of their lives and their most productive years, leaving behind families and children. This preventable tragedy is exactly what India's national HPV mission is all about: ending.
Okay, so how does this actually work? To beat an enemy, you've got to understand it first. So let's take a look at the culprit, the virus, and the shield we've designed to stop it.
So the bad guy here is the human papillomavirus, or HPV for short. Now, it's a super common group of viruses. Most infections actually clear up all on their own. But, and this is the key, a persistent infection with some of the high-risk types is what directly causes almost all cases of cervical cancer.
And what's really fascinating here is just how specific this enemy is. Check this out. In India, just 2 high-risk types of the virus, we're talking HPV 16 and 18, are responsible for over 80% of all cervical cancer cases. That creates a crystal-clear target for a vaccine. Now, the journey from getting the infection to actually developing cancer, it's a long one. It can often take 15, even 20 years. And that long window, that's exactly why vaccinating girls in early adolescence, before they're likely to ever be exposed to the virus, is our most powerful weapon. We're stopping the clock before it can even start ticking.
Okay, so the science is solid. But what's the actual game plan on the ground? How is India going to pull this off? Let's break down the national strategy for taking this preventable disease head-on.
The plan itself is incredibly clear. And wow, is it ambitious. The target? Roughly 1.2 crore. That's 12 million 14-year-old girls every single year. They'll get a single dose of the Gardasil 4 vaccine at government health facilities. And the best part? It's completely free for everyone.
Okay, now here's a really key part of the strategy, and honestly, this is a total game changer. They're shifting to a single dose. You might be asking why? Well, the science is showing its effectiveness is incredibly high, almost the same as a multi-dose schedule. This move doesn't just slash costs. More importantly, it means way higher compliance because you avoid the risk of girls dropping off before getting a second dose. It's a smart, powerful choice, and it's backed by the World Health Organization.
But a plan this huge faces more than just logistical hurdles. Past efforts have hit some major roadblocks. So building that community trust, it is absolutely critical for this whole thing to work. So before this big push in 2026, vaccine uptake was, well, it was practically zero. We're talking less than 1%. And why was that? It was kind of like a perfect storm of problems. There was super low awareness, a ton of dangerous misinformation linking the vaccine to things like infertility and a deep social stigma since HPV is sexually transmitted. And on top of all that, cost and just getting access to it were huge barriers for most families. So the new strategy is tackling these problems head-on. First, and this is brilliant, they're reframing the vaccine. It's not about an STI, it's a cancer prevention tool. That's powerful. They're also empowering trusted local health workers, called ASHs, to go door-to-door and bridge that information gap. And, this is crucial, they're making parental consent mandatory, which ensures families are part of the decision, all while working with medical groups to keep communication transparent.
You can't possibly run a mission of this size without a seriously powerful engine behind it. So let's look at the innovative digital tools that are making this whole national campaign possible.
The whole operation really runs on this digital backbone. You've got the UN platform, which is what the public sees. It handles all the registration and tracking and creates a permanent digital health record for every single girl. Then behind the scenes, you have the EVIN system, which manages the massive logistical puzzle of the vaccine supply chain, making sure every dose gets exactly where it needs to be right when it needs to be there.
So for parents, the whole process is designed to be super straightforward. You just register your daughter on the UN platform, give your consent, and then head over to a government health facility for the free shot. Afterwards, you can even download a verifiable digital vaccination certificate. It makes the whole thing seamless and totally accountable.
So, what does this all add up to? Well, this campaign is about so much more than just protecting girls in India. It's actually a massive leap forward in a global fight to eliminate a cancer for good.
This mission lines India up perfectly with the World Health Organization's really ambitious 90-70-90 global strategy. What's that? The goal is to get 90% of girls vaccinated, 70% of women screened, and 90% of those with the disease treated. India's vaccination drive is the huge first pillar needed to make that global dream a reality.
You know, this quote just captures it perfectly. This isn't just some one-off health program. It's a deep, long-term investment, socially and economically, in the health of an entire generation. It's about making sure millions of women have a future that's free from the threat of this totally preventable cancer.
So with this bold, science-backed, and tech-powered mission, India has taken a truly giant leap forward. Now, the road ahead is still going to require a ton of effort, but for the very first time, the answer to that huge question, are we on the verge of actually eliminating a cancer? Well, that answer finally seems to be within our reach.